Hello everyone, myself Manivel Praveen from group LA11932. Today I am going to present the topic of lateral group of leg guided by Professor Alexander Bitriski. First, we are going to see the surface landmarks. The palpable structure are fibular head and fibular neck in the lateral compartment of the leg. Next, the layers. The layers are arranged as skin, subcutaneous tissue, superficial fascia, and deep fascia. Next, we are going to see the muscles of the lateral compartment of leg. There are two major muscles in the lateral compartment of the leg, the fibularis longus and the fibularis brevis. These are also called as peroneal longus and peroneal brevis. First, we are going to see the fibularis longus. The fibularis longus originate from the upper lateral surface of fibula, head of fibula, and lateral tibial condyle, and the fibers converge into a tendon which descends into the foot posterior to the lateral malleolus. Then the tendon crosses under the foot and attached to the bones on the medial side, namely the medial cuneiform and base of first metatarsal. Next, we are going to see the nerve supply. The nerve supply to the muscle is from the superficial fibular nerve from the spinal cord segment L5, S1, and S2. Next, the actions. The movement associated with this muscle are eversion and plantar flexion of foot, and it supports the arches of the foot. The second muscle is the fibularis brevis. The fibularis brevis muscle is deeper and shorter than fibularis longus. It originates from the inferolateral surface of the fibular shaft, and the muscle belly forms a tendon which descends with the fibularis longus into the foot, and then it travels posteriorly to the lateral malleolus, passing over the calcaneus and cuboidal bones. Then the tendon inserts to a tubercle on the fifth metatarsal bone. The nerve innervation to this muscle is also by superficial fibular nerve, and the movement is also eversion of the foot. Next, we are going to see the nerve supply to the lateral region. The nerve supply to this region is mainly provided by the superficial fibular nerve. The superficial fibular nerve is one of the terminal branches of the common fibular nerve. It arises in the substance of the peroneus longus muscle on the lateral side of the neck of fibula, and it descends between the fibularis longus and fibularis brevis muscle, the lateral side of extensor digitorum longus, and there it gives rise to the motor branches which supply the fibularis longus and fibularis brevis. Then the nerve continues its descent with a purely cutaneous function, providing sensory innervation to the anterolateral aspect of the lower leg. When the superficial fibular nerve reaches the lower third of the leg, it pierces the deep crural fascia and terminates by dividing into the medial and intermedial dorsal cutaneous nerves. These nerves enter the foot to innervate the majority of its dorsal surface. Next, we are going to see the sensory and motor function. First, the motor function. The superficial fibular nerve supplies the fibularis longus and the fibularis brevis. These muscles form the lateral compartment of the lower leg. They act to avert the foot and thus act at the subtalar joint. They also weakly contribute to the plantar flexion, although this action is mainly carried out by the gastrocnemius and the soleus muscles. Next, we are going to see the sensory function. The superficial fibular nerve provides cutaneous innervation to the certain areas of the leg and foot. It innervates the skin over the anterolateral leg through the cutaneous branch directly from the superficial fibular nerve. It also innervates the skin of the dorsum of the foot except the webbed space between the hallux and the second digit through the medial and intermediate dorsal cutaneous nerve. The dermatomes to which these areas correspond are L5 and S1. Next, we are going to see the blood supply. The blood supply to the lateral compartment of leg is mainly provided by the fibular artery. The fibular artery is also known as the peroneal artery. It supplies blood to the lateral compartment of the leg. The fibular artery arises from the bifurcation of tibial fibular trunk into the fibula and posterior tibial arteries in the upper part of the leg proper, just below the knee joint. It runs towards the foot in the deep posterior compartment of the leg, just medial to the fibula. It supplies a perforating branch to both the lateral and anterior compartment of the leg. It also provides a nutrient artery to the fibula. Next, we are going to see the clinical relevance. There are relatively common pathologies involving the damage of superficial fibular nerve, which are entrapment and direct damage. First, we are going to see the superficial fibular nerve entrapment. The superficial fibular nerve entrapment, which is also known as nerve compression, can cause pain and paresthesia over the lower leg and dorsum of the foot. Entrapment frequently results from ankle sprains or twisting of the ankle, as this causes the nerve to stretch in the lower leg. The another cause of nerve entrapment occurs at the point where nerve exits the deep fascia of the leg, the nerve becoming compressed by this fascia. Surgical decompression of the nerve, therefore, is used to provide relief from the symptoms and pain. Next, we are going to see the direct damage. The direct damage to the superficial fibular nerve. The superficial fibular nerve may be damaged by fracture of the fibula or by a perforating wound to the lateral side of the leg. As the muscle that superficial fibular nerve innervates or evertas, injury to the nerve may result in a loss of aversion, a loss of sensation over the majority of the dorsum of the foot, and the anterolateral aspect of the lower leg could also result. Thank you for your attention.